A Cup of Joe, talking about healthcare topics. I'm going to be joined by one of our board members, Jess Stuart, at Pier 36, one of my favorite restaurants in Richmond. I get oysters and ceviche there every day. They know my order. Hello, everybody. This is Joe Freudenberger, joining you again for A Cup of Joe, where we talk about healthcare topics of the day. I'm joined here at Pier 36 in Richmond, a well-known establishment run by Jimmy Cantu, really super guy, super community supporter, and we enjoy his food. I've been having oysters and ceviche here for the last probably 4 years. Jess Stewart, one of our board members and a longtime member of our community, is joining me today, and we're going to talk about some things from a board member's perspective that might be interesting. So let's get started, Jess. So what led you to join our board? I mean, it's a high-paying position, isn't it?
Get paid mega dollars, Joe. No, it's totally volunteerism. For me, it's home. Oat Bend is about home.
Okay.
And not only, like you said, I've been a long-time resident here in Fort Bend County.
How long?
Well, my family's been here since 1824.
Wow.
So 202 years.
Wow.
So I've been here a lot. I'm 8th generation Texan.
Okay.
So Oat Bend is home because that's where I had my tonsils out when I was a kindergartner at 5 years old. So we go way back, right?
Okay.
That's where my daughter was born.
Okay.
And the latest incident that I had was in 2016. I had a heart attack.
Okay.
And I went straight to the no-wait ER, I might add.
Yep. Thank you.
That Oat Bend is known for in this community. And I actually walked in, had a whole EKG run. I was having a heart attack on the spot. And yes, I drove myself all the way to the hospital and made it. Thank God. God was in my hands.
Not the best of choices, but
True,
okay, you
true,
made it.
True. But I made it, and within an hour, I had 2 stents put in.
Wow.
So I owe Oat Bend a gratitude of just they saved my life.
Wow.
So I want to give back. So that's why when you came and asked me that first time about joining the board here at the Oat Bend Hospital, I said absolutely. And so that's why I wanted to join.
Now, I always observe folks that join our board that are not in the healthcare profession can be a little bit shocked by the differences between a hospital operation and, a normal business operation. So what has been surprising to you since you joined our board?
So what's been so surprising is how complex a hospital system is behind the scenes.
Yeah.
Because the normal Joe comes in and has an emergency and goes in and gets services and then leaves.
Right.
But as a volunteer, and then even now learning about the staff team when we sit in the board meetings to see the complexity between how, especially a nonprofit hospital.
Yeah.
Which is very unique in this area, right? How they run their marketing, their staff teams, all the federal regulations, the state regulations, all the check-ins, all the KPIs. I mean, everything that comes rolling up into one, the average Joe's not going to see that unless you're in there day to day.
Yeah, it is. And, we're 1,200 employees, almost $1 billion in revenues.
Yes.
It's a pretty sizable operation. For being a mid-sized hospital, we're still a sizable operation. So excellent. Well, I wanted to invite you here today to get your perspective, but also to answer questions that you might have the average viewer might not be familiar with.
One question that keeps coming up when I talk to folks out in the community, be a board member, is what are the cost of having a staff person like a nurse? Why is it such a high cost to hire and train and keep retention? And that's the key word, retention of a nurse today.
Okay, well, you asked 2 questions, so let's talk about the cost of a nurse. So typically I ask people, what do you think the cost of an additional nurse is? And they'll guess, somewhere between $80,000 and $100,000, which is roughly speaking the salary of a nurse. And then, of course, they don't remember about benefits, which is another 30%. But what they don't think about, because our brain is not wired this way, is one nurse is only 40 hours a week, but we run 24/7.
Yes,
So
yes.
you got to cover 168 hours in a week, which is 4.2 or 4.3 equivalent nurses. So now instead of it being a $120,000
Yeah.
nurse, it's 4 times that. So you're looking, one nurse is a $500,000 investment per year to staff it. Now, you asked the second question, why is there so much turnover? I'll be frank, it's a tough job.
Yes.
It is a tough
Yes.
job.
Yes.
Nurses are on their feet most of the day. They're dealing with complex situations. The human body is the most complex organism on the planet. So they're dealing with complex situations and emotional situations. And, it's burnout city. It's just waiting for somebody to burn out. And people often think, well, maybe it'll be better somewhere else, but then it's not because all hospitals have the same underlying issues. It's a tough, physically demanding, emotionally demanding, complex job.
Yeah.
And that is part of the one of the biggest reasons for so much nursing turnover. And it's not just here; it's across the country.
How many total staff are currently employed roughly at Oak Bend?
Roughly 1,200 employed and contracted staff.
Wow, that's a lot.
Yeah, it's a huge,
That's a lot.
huge number of people.
So with that said, how does Oak Bend compete against the big competitors? Because Fort Bend County is growing. You have all these healthcare systems coming in. What sets? And I know we're a nonprofit and we serve the underserved, but how do we compete against those competitors?
Well, in two ways. Number one, we try and establish a culture and a style of care that is much more family oriented, friendly. In healthcare, and I've been a frequent flyer in the healthcare business industry as a patient, um, it's a scary place to be if you're a patient. And what we try and do is warm it up. Our environment warms it up. Our people warm it up. Smiling. If you walk down the halls of Oak Bend, you will get one person after another person greeting you and smiling at you. We want you to feel comfortable, and we want to lower the stress of the environment, not ramp it up by making it cold and impersonal. We want to make it very personal. That's number one.
Right.
Because you can't get that in every hospital.
Right.
Number two, we offer a set of niche operations, services. We have a unit for our elders with mental health issues. We have a unit for rehabilitation, our skilled nursing unit. We have a no-wait ER that you described, the only one of its kind in the greater Houston area.
Right.
So if you want a comprehensive hospital that offers all the services and you want a no-wait model, you got to come to Oak Bend.
That's right.
And we'll actually get you in and out before some people get you out of the waiting room. So niche operations, a family-friendly, warm environment, and a focus on quality. Everybody has a focus on quality, but we deliver on it. 90% of the measures of quality that Medicare tracks, 90% of them, we beat our competitors in Sugar Land.
Wow, that's huge.
Everybody thinks, smaller is not necessarily better. I'm telling you, smaller in hospitals is better.
How does Oak Bend recruit and retain their doctors?
Same model. We promote a culture where collegiality. So you go to the big hospitals, and you're one of a lot of doctors, and it's hard to build relationships when you see somebody once every 2 years, something like that.
Right.
Whereas at Oak Bend, we have a smaller, not small, but a smaller group of physicians. They see each other every day. They get to know each other. And that actually leads to better care because they're more coordinated in how they deliver care.
Yeah.
Because they know each other. They know each other's strengths and weaknesses, and they can work off of that. It's a really good environment.
Right.
And when we find physicians that want that environment. Some people want to be in the medical center, want to be in the giant teaching facilities. We're not that. We are a teaching facility, but we're a mid-sized teaching facility, and we look for doctors that enjoy community, focus on a community, and focus on collegiality.
So with that said, how important is it that our Wharton campus be successful as far as moving services out towards, as this county continues to grow out towards Wharton County?
Well, people don't always realize this, but healthcare is a business. And as is true of any business, if you're not growing, you're dying because somebody
Yeah.
else is growing and taking business away
Yeah.
from you. So Wharton is a key growth area for us. It's been very good for us. It's been a really wonderful addition, and it fits within our mission. So it's both valuable strategically
Yeah.
and valuable from a mission standpoint because it is definitely a community that has underserved pockets of,
Yeah.
of residents that desperately need access to a hospital.
So one thing that we talk about quite a bit in our board meetings, and I've always want to follow up on, is how important is it for our patients to fill out their patient survey at the end of their experience moving forward?
We can't improve if we don't get feedback. One of the beauties of having a community board such as and community members such as yourself is that you get feedback from the community about what we're doing right and what we're doing wrong. And we can then use that to improve our services. The reason our quality metrics are so good, I believe, is because we have good feedback from our community as to what we need to do better. And so that survey is incredibly important. It tells us when we have people in our midst, and I hate to admit it, but we have some staff that are not as focused on the kind of medicine we want to deliver, that family-friendly medicine. And we need to hear about it from our community when that occurs so we can go find that person out and counsel them, hopefully improve them, and if not, allow them to seek opportunities elsewhere.
Great answer. One more question I have. And
You
this
mean
is the big one.
It's a good answer. I can keep my job?
Yes, you can.
All right.
Keep going. All these years you've been here, keep going.
Okay.
We need many more episodes of Cup of Joe, right? So one of the things that some of the folks will say out in the community is, why do we charge so much, yet paid so little?
Well, they don't know that we get paid so little. They get this big bill, this $100,000 bill, and they think, "Oh my God, what did they do for $100,000?" And the answer is, it is a byproduct of governmental regulations since the 1960s when Medicare and Medicaid was established, where hospitals just had an inducement to increase their prices, and then the payers, Medicare, Medicaid, Blue Cross, United, slowly but surely put more and more rules in place that prevent us from getting paid based on our prices and get paid based on negotiated rates. So on average, we get paid less than 20 cents on the dollar. So if we charge you $100,000, on average, we're going to get paid $20,000 for those services. And Medicaid pays 10 cents on the dollar. Medicare pays about 15 cents on the dollar. So 10,000 for that 100,000 if it's a Medicaid patient, 15 if it's a Medicare, 20 or thereabouts, or a little bit more if it's a commercially insured.
I was going to ask you that was going to be that, but you triggered. What do you see the future of Medicare and Medicaid? That's a big question.
They're essential providers of care to the poor, Medicaid to the poor, and Medicare to the elderly. Without them, those populations would not have access and would suffer. I mean, life expectancy would go down. In the United States, on average, those without health insurance live 20 years, a shorter life, 20 years shorter life than those with insurance. That's the scary
part.
The scary reality out there. Health insurance for the poor, health insurance for the elderly is critical.
Well, you've answered my questions.
Well, good. Well, we're now going to have a wonderful meal here, and maybe Jimmy will come over at some point.
Yep.
We'll introduce him to our viewership.
How you doing, sir?
Okay. Oh, well, here's the man of the hour right here, Mr. Jimmy Cantu from Pier 36 Seafood. And listen, if you're the mover and shaker in this county, you come to this restaurant right here. And I'm going to turn it over to Jimmy, and he'll talk a little bit about how important Pier 36 is.
Well, first of all, these two guys fight over a table. They have their set table, which threw me off because this isn't it. But they're together. So it's whoever gets here earlier, it's either Jess's or it's Joe's table. That says how often they come here. So
J&J.
That's right.
But when did you start?
We started in 1997 in Needville on Highway 36. That's where the name Pier 36 comes from. And we opened this location in 2006. So we're entering our 20th year this year. So
And I've been coming here since 2007.
that, yes, sir. I believe it.
2008. That's why we're J&J on the table over here. I always tell Jimmy and Joe, we have to cut that table in half when we retire, and he'll get half, I'll get half.
Yep.
But you also have a Fulshire location.
Yes, we have a location in Fulshire. We opened in 2018, and that one's going great. Fulshire's growing like crazy, as everyone knows. But we started here, and these guys are a big part of that. So,
Well, we enjoy your food
Yes,
and
thank
we
you.
enjoy your service too, and
Thank
your
you.
support, because Jimmy is a
Yes,
supporter
he is.
of the hospital. So thank you.
Thank you,
yes,
Jimmy.
sir.
Thank you.
Nice seeing y'all.
Yeah.
Thanks for coming.
So thank you again for joining us today on Cup of Joe. And Jess, thank you so much for joining us and being a member of our community and being such a wonderful supporter. We couldn't appreciate you more.
Thank you, Joe.
See y'all next time.